Let's cross over again now to Cross River State, where we have Dr. Betta Edu standing by to speak with us. Doctor, you were trying to share your views about how true the statistics from your state. Well, your state seems to be COVID-19 free. How true is this?
Hope you can hear me now. For now, the Cross River State government has been working very hard to see that we can have and maintain the COVID-19 free status. It's been a lot of work. We started very early as January, to set up the EOC and then start sensitization, especially at the borders and, of course, in the hard to reach areas. I'm sure you know we're the first state in Nigeria that started screening people who came in through their local airports and, of course, their interstate borders. And we shut our borders quite early. Remember, the virus doesn't move, people do. All the test samples we have taken, they have all returned back negative. We've started our massive screening across the various local governments, especially by the border areas that border Cameroon and the interstates that border Akwa Ibom, Ebonyi, Benue, and other Abia states. We've been doing a lot of work. We set up the task force, provided vehicles for them to work. We've created 3 isolation centers with a total of 130 bed space. We've trained 400 health workers to be able to respond to the coronavirus if we have it at any point in time. But for this time, Cross River State is still COVID-19 free. We've had NCDC coming. We've had the Federal Ministry of Health and the National Primary Healthcare Development Agency coming to see what we're doing. And they were quite impressed with what the state government was doing. And of course, it told us the gaps, which include the fact that we need to quickly set up a testing center in our state so that we don't go through the cumbersome process of sending samples to Irua in Edo State or sending samples to maybe Ebonyi State or Abuja.
If you can hear me, talking about testing, which remains a major challenge in Nigeria. I mean, our testing capacity is very, very low. Let's talk statistics. Give us or talk us through the testing capacity of your state. I mean, give us numbers if possible.
So there are 2 types of tests, I'm sure you know. We have the antigen rapid test kits that we use for massive screening across the local government, and we have done over 530 of those. And then, of course, the PCR test, which is done when we find samples that are suspected cases. We send to the PCR. For that, we've done, I think, about 8 right now, and we have 2 samples that are moving in over this weekend.
Well, Dr. Betta Edu, just before I let you go, you may need to just talk to us about the efforts of the state government in ensuring the safety of frontline workers, as well as issues of hazard allowances for the health workers, and then efforts as well to reach the grassroots. I understand Cross River State is probably the 2nd largest state in Nigeria. I mean, what are the efforts of the government to reach the hinterlands and the grassroots?
Work for us here in Cross River State. Basically, first, we've done a lot of work as early as January. We provided personal protective equipment for health workers all across the state. We didn't limit it to just the public facilities that are owned by state. We supported the University of Calabar Teaching Hospital. We also supported several private hospitals, military, paramilitary clinics, just so the health workers and frontline health workers can be able to do their work in very good environments without fear of coming down with the coronavirus if they are exposed to anyone who has the virus. So it's been a lot of work. We distributed all of those things to them. And every other month, we continue to top up on the PPEs, and of course, the N95 nose masks, which we give to them. There are gloves, hand sanitizers, amongst other things that are provided for the health workers. And beyond that, we have incentives for health workers that will be working at the isolation centers. Doctors are expected to be paid 100,000 per week, and of course, other health workers have various grades of payment. Even non-clinical workers will also be paid, like the sanitarians, morticians, and others would be paid a reasonable amount of money to incentivize them to continue to work during this period. Cross River State, like you very well noted, is a very, very large state, and it is bordered by Cameroon. Cameroon has close to 400,000 positive cases, confirmed cases in Cameroon. And it's been a lot of work by the Cross River State government to continue to sensitize those who are in the hinterland, hard to reach areas, and the border areas in Cross River State. We've had to pay task force commissioners, special advisors, chiefs, local vigilante, and the rest of them to keep a 24 hours watch on these borders to ensure people don't come in from Cameroon. It's been a whole lot of work, but sensitization is still going on. And like we tell Cross Riverians, if you see anything, say everything. It's not just about government. It has to be a concerted effort by everyone to see that we keep our states COVID-19 free, or if we record any case, we can provide proper care and treatment for those who have been affected. Really, I feel we should demystify COVID-19, reduce the fear, the scare, and the rumor around it, and see how we can give proper care to people who might come down with that disease or several other diseases that are killing people. The high fear in health workers is beginning to lead to negligence, and more people are dying from several other diseases across the nation. This should not be the case.
Dr. Betta Edu would like to thank you most kindly for your thoughts as well as your views. It's always a pleasure to speak with you.
Thank you.